Hello, today I'm going to speak a little bit about sertraline, um, which is an antidepressant drug. Generic name is sertraline and brand name is Zoloft. So sertraline is an antidepressant, but more specifically, it is a selective serotonin reuptake inhibitor, or an SSRI. Um, so sertraline is an SSRI antidepressant that works by blocking the reuptake of serotonin. And so the reuptake of serotonin involves the reabsorption of serotonin by the nerve cells that secrete it. And by blocking this action, serotonin availability increases. So serotonin is a vasoconstrictor that plays an important role in sensory reception and sleep. And it also acts as a messenger between nerve cells in the brain. Sertraline is used for a variety of reasons and to treat a variety of different disorders, not just depression. And these include major depressive disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, social anxiety disorder, and premenstrual dysphoric disorder. Some contraindications of sertraline would include monoamine oxidase inhibitors, or MAOIs, which can increase when these medications are taken together. There's an increased risk of serotonin syndrome, which I'll talk about a little bit later. So use of MAOIs should be ceased at least 14 days before beginning any SSRI medication, which includes sertraline. Pimozide can also increase risk of QT prolongation and development of ventricular arrhythmias when taken with sertraline. And so that medication should not be taken along. Patients who take sertraline should not be started on that medication. All patients should be screened for bipolar disorder before being prescribed sertraline, as it may cause an onset of manic episodes in individuals with the disorder. Sertraline does have a few side effects and adverse reactions, although it is generally considered a very safe antidepressant compared to others due to its low amount of side effects. Most common side effects include nausea, insomnia, headache, dry mouth, anorexia, increased risk for bleeding, especially if taken with anti-inflammatories such as aspirin or warfarin. Diarrhea may also be a side effect. A special consideration should be taken when prescribing this medication, sertraline, to young adult and pediatric patients, as an increase of suicidal thoughts and behaviors may occur in this demographic specifically. Although the drug is still prescribed to these patients, it just calls for more monitoring. So let's talk a little bit about serotonin syndrome. Although it's very uncommon, it may occur in patients taking medications that increase serotonin levels like sertraline, usually when multiple antidepressants are taken together. Serotonin syndrome is caused by extremely elevated serotonin levels, and symptoms include anxiety, high fever, tachycardia, and significant blood pressure changes. And this does require immediate medical attention. Dosing really varies depending on the disorder being treated, the patient's age, and the response to the drug. Most starting doses range from 25 to 50 milligrams, while maximum dosage is 200 milligrams. With sertraline, it's really important to increase and decrease sertraline doses gradually to allow body time to adjust to the new treatment and new dose. So not all patients, not a 50 milligram dose might not be effective for all patients. In that case, a provider would slowly increase their dose over a period of time until they're taking an effective amount. The same goes for patients who are wanting to stop the medication. The dose will be gradually decreased until the patient is no longer taking the medication. So patient education is really important when prescribing or starting any patient on a new prescription. It's always important to discuss side effects and adverse reactions with patients so they know what to look out for, they know what might be normal and what they need to report. Ensure patients are aware of which medications may interact badly with sertraline, including both over-the-counter and prescription drugs like aspirin, warfarin, and pimozide. Sorry. Advise patients to observe for any adverse reactions. Presence of any adverse reactions should be reported to a physician immediately, especially any increase of suicidal thoughts and behaviors, signs of serotonin syndrome, and excessive bleeding. Lastly, I have a few questions for my fellow classmates. Firstly, if your patient was considering beginning sertraline as a treatment for their obsessive compulsive disorder, but had reservations about taking medication, how would you provide information for your patient without inferring your own bias regarding treatment? And then secondly is, what concerns and questions do you think a patient considering beginning sertraline might have, and how would you answer them? I look forward to seeing your responses as well as your presentations. And this concludes my presentation on sertraline.